This morning we are here with Dr. Sims' office with Mr. Paul Proctor, and Paul came to us about a month ago, a month and a half.
Today's day 29.
All right, and he had some knee symptoms and some neuropathy symptoms that were giving him some trouble. Paul, give us a little background as to why you sought treatment here with Dr. Sims.
Well, I kept checking into. I knew the burning in my feet, and so I've had neuropathy for the past 3 or 4 years since I retired, walking on concrete, and my feet were getting worse, and my knees were getting to where I couldn't walk very far. I love hunting, I love fishing, and the stability and stuff. I was losing my mobility. I was getting to where I couldn't move around without tripping or falling, and my balance was about gone.
All right, so you've been with Dr. Sims approximately a month now.
Yes.
Doing treatment, and tell me a little bit about how your treatments have gone.
My treatments from day one, when he my first exam, and showed me how to loosen up my body, my knees, and the oxygen. I was losing circulation in my feet. My feet were cold. I mean, a temperature of 80 degrees in both feet. So I had no circulation. So in the meantime, with the programs and things, and weight loss, taking pressure off my knees, I've got to where I have a lot more mobility. I've lost 12 pounds in 29 days.
Wow.
And with the anodyne machine, I do it an hour in the morning on 30 minutes on each leg, which is an infrared machine, and it helps. And then I got 30 minutes of a nerve rebuilder. We're rebuilding the nerves in the bottom of my feet and my legs.
All right, and
for circulation.
And what kind of improvement have you seen in just these 30 days?
Just in the 30 days, I feel better. I get up at 4 o'clock every morning. I do the therapy on the regiment, hour and a half in the morning. Then I come up here. I've got 2 days a week that I come to the center here on Tuesdays and Thursdays, but I still do my program hour and a half in the morning before I come here. I do it at hour and a half at night before I go to bed, and I take my supplements. I mean, everything is, to tell you, it's a blueprint. What it says, it's blueprint to your health. And with this blueprint, it keeps you monitored every day what you need to do.
Okay, so there's been no confusion?
No confusion. It's very laid out, and it's very precise what they want you to do. And if you stick to the plan, it works.
All right. So what are you able to do now, like lifestyle-wise, that you weren't able to do before?
I can walk farther, longer distance. I'm more stable on a ladder and climbing or moving things, lifting things. Most of it is my mobility. I'm not worried about my balance. I've got balance now. I didn't have balance. The burning sensation in my feet from neuropathy is going away little by little. I don't have it as much. My legs feel rested, and I feel rested.
Great. So you're getting good sleep?
Somewhat.
Okay. All right. Well, Paul, we really appreciate you talking with us today and sharing your story. Lastly, I would just ask, would you recommend this to someone experiencing knee pain or neuropathy?
I have recommended it to some people. I have talked to some people this weekend, and when they get back home and stuff, they've asked me, I've had a lot of people ask me how it's working.
All right. Well, thank you so much for sharing your story.
You're welcome.